Great. Thank you so much, Cameron, and thank you to everyone for joining us today for the National Alzheimer's and Dementia Resource Center webinar, Unique Approaches to Support Brain Health and Reduce Risk Through Education, Exercise, Diet, and Art. The National Alzheimer's and Dementia Resource Center webinar series is supported by the Administration for Community Living. Today's presenters are Aaron Long, Heriberto Santiago, and Yaeliz Torres. Aaron Long leads the Administration on Aging's state, community, and tribal grant programs dedicated to supporting people living with Alzheimer's disease and related dementias and their caregivers. The Administration on Aging's Alzheimer's disease and related dementias programs are dedicated to building and expanding dementia capability across the United States through culturally competent education and training on a broad range of dementia-related issues, as well as the provision of direct services through evidence-based interventions. In addition to being responsible for the planning and development of the programs, Aaron Long provides programmatic guidance and oversight for all program activities, including the National Alzheimer's and Dementia Resource Center, as well as serving as a federal member of the National Alzheimer's Project Act Advisory Council on Alzheimer's Research, Care, and Services. She holds a Master of Social Work degree from Virginia Commonwealth University in Richmond, Virginia. We also have with us today Heriberto Santiago, who is co-founder and executive director of GrownUps Puerto Rico. After serving in the U.S. Army, he worked in health administration services at the San Juan Veterans Administration Hospital. He holds a bachelor's degree in psychology and a master's degree in public health with a specialty in gerontology. Mr. Santiago is a certified Montessori elder care practitioner by the Association Montessori Internacional and a certified Spanish and English master trainer for diabetes self-management, building better caregivers, and other evidence-based and evidence-informed programs. He currently serves as director of the WE program at GrownUps Puerto Rico. Finally, we have Yaeliz Torres, who is joining us today. She is the case manager for WE program and a licensed clinical social worker. As she joins us today, she will share about the WE program and how clients are benefiting from the services and supports they receive from the program. At this time, I will turn the presentation to Aaron Long to begin.
Hi, everyone. It's at this point that I usually thank all of our speakers for coming, and for gracing us with their knowledge. But today it's me that's going to talk, and I just want to thank Heriberto and Yaeliz for joining us and being willing to talk about the program. We're very proud of the work that ACL has funded for them. But what I'm going to do is lay a little bit of groundwork, set the stage for why we do what we do in terms of brain health and risk reduction. So next slide, please. So with the, just want to lay out what our learning objectives are here. First, we're going to talk a little bit about, I'm going to talk about brain health and risk reduction, sort of give you definitions and talk about a little bit of risk factors and tips, and also just highlight some resources that are available through the National Alzheimer's and Dementia Resource Center. Next slide, please. Just as some background in terms of risk reduction, the work that we do at ACL is much of it is driven by the work of the National Alzheimer's Project Act Advisory Committee for Care and Services. In 2011, the National Alzheimer's Project Act, the NAPA, became law. And it immediately, they created the Advisory Council in 2012. They created the Advisory Council, and the Advisory Council created a plan. And the first national plan had 5 goals. And you can find those on the ASPE website. But so in 2012, we started working on these 5 national plan goals. And in 2012, and risk reduction was not one of the 5. And in 2021, it was decided that it was super important for us to add a 6th goal to the national plan. And that 6th goal is to accelerate action to promote healthy aging and reduce risk factors for Alzheimer's disease and related dementias. And With the creation of that sixth goal, we have these subcommittees that create a federal and non-federal partners, and they create recommendations for the national plan. That's not just for the federal government to do a bunch of things, but it really outlines what states, counties, communities, and just general individuals can do to help advance the dementia capability of our nation. So just for context, in 2022, we actually celebrated the 10th anniversary of the National Plan to address Alzheimer's disease, and we continue to meet. We had our last meeting for the NAPA Advisory Committee was April 30th, and we had great conversations about early onset and some clinical discussions. So with that, I'm going to get a little bit into some insight into what we're talking about when we're talking about brain health. So next slide. So I just want to provide a very simplified definition of brain health for you. It's brain health refers to how well a person's brain understands concepts, manages motor skills and emotions, and receives messages, tactile messages like temperature, pressure, and pain. But those are the four areas that your brain functions. Cognition is, how you think, learn, and remember. Your movement, how you make and control movements. How you interpret and respond to emotions, and touch is how you feel and respond to sensations. I mean, if we think about in all of these things in context to a person living with Alzheimer's, I'm sure we can see the people that we know in those areas. So along with brain health, to maintain our brain health, there's things that we can do. There's what we know what are known as risk factors. So next slide, please. When thinking about risk factors, they can be put into essentially two categories: modifiable and non-modifiable. The non-modifiable risk factors are those things that can't be changed: your age, your genetics, your family history, and race and ethnicity actually have a role in the risk factors that we're subject to. There are also modifiable risk factors, and those are encompass a broad range of lifestyle and health related causes that people can act on, and they can, by acting on those things, we can reduce our risk or possibly delay any onset of cognitive challenges. So the modifiable risk factors include physical activity. Do you exercise? Do you keep blood flowing? Obviously, substance use and abuse, tobacco and alcohol use, maintaining a good diet. Anybody who's paying attention to Alzheimer's, there's a regular conversation about a Mediterranean diet. Chronic health conditions. Heriberto is an expert in managing chronic health, the evidence-based interventions related to managing chronic conditions, hypertension, obesity, diabetes, hearing loss. Hearing loss is one that hasn't gotten a whole lot of attention lately, but it's beginning to raise in its prominence in the discussions related to Alzheimer's and related dementia. Since the pandemic, we've talked a lot about social isolation and loneliness. That's definitely a modifiable risk factor. Staying engaged, to use your brain through social engagement, and cognitive inactivity is also connected to is a modifiable risk factor. I used to joke and say, if you don't use it, you'll lose it. So, you know, be using your brain, doing things, engaging in activities to keep your brain intact is a great way to reduce risk for developing dementia. Some studies actually say that modifying your risk factors might prevent or delay 40% of dementia cases, and that's a pretty significant number to motivate one to pay attention to all these things that we can impact to support ourselves. Next slide, please. So we can do things to reduce our risk. We can prevent and manage those chronic health conditions that I previously mentioned, and working towards by managing those conditions, we reduce our risk, making healthy lifestyle choices, you know, and it's good stuff too. It's being active, going to bed, getting enough sleep, eating healthy, don't smoke, limit your alcohol use, and all of these things protect your brain. And by, you know, thinking back to the previous slide where, you know, trying to limit isolation, keeping your mind sharp, staying engaged, but and that's at the core of taking care of social and emotional health. Getting treated for depression if it exists, and staying that, again, all roads are leading to that social connection and engagement, and using your brain. For the next slide, so that's sort of the highlights of what we're talking about when we're talking about brain health and risk reduction. Now I just want to go a little bit into what ACL has been doing over the last decade. Essentially, in 2014, the Administration for Community Living, the National Institute of Health, specifically the National Institute on Aging, and the CDC collaborated to develop the resources contained on this page, the Brain Health You Can Make a Difference page on ACL's website. And in the, when you receive the deck, you'll get the link. And there are tools on this page that are designed to enable community-based organizations or whomever to deliver this information in community and professional environments. And it was updated in 2018, but it really includes, just on the side of the page, you can see that it includes a broad range of resources, PowerPoint presentations that can they're literally a curriculum, brain health basics, medicine, age in your brain. One of the things that we focus at ACL on a lot is evaluation, to show that you're having the desired impact, that you're training. People are actually taking information away from it. So we have also created an evaluation bank of questions to evaluate the impact of the trainings and the other resources. So it's worth a look to see what we have in terms of questions for evaluation. Next slide, please. So that slide talked about what we have on the ACL website, but for those of you that are not as familiar with the National Alzheimer's and Dementia Resource Center, which is Sari, who introduced the webinar, is the co-director of our resource center. There are a tremendous number of resources included on that webpage. It's nadrc.acl.gov. And in addition to, so when our grantees create things, we make those resources available, curriculums and such. And then also the NADRC creates resources. When we identify topics, we create resources on our own. And we have a new one that's coming that is entitled Promoting Brain Health and Reducing Dementia Risk Factors, that will provide in-depth background on the issues and then highlight some of the work that our grantee programs have done to address these issues in their communities. There's a link there to the brain health page that I previously spoke about, as well as links to a webinar that we did in 2021 on the same topic, but from a little bit of different perspective. It highlighted some work that we did, that our grantees did in the state of Ohio. And as well, there's many more resources within our webpage that highlight brain health insights within documents, within other curriculums, materials that are created there. So worth taking a look at what's available to you there. And with that next slide, I just want to turn it over to Heriberto and Yahalis to tell us all about the wonderful things that they're doing in Puerto Rico. Thanks.
Thank you, Erin, and thank you, Sari and Cameron, for the assistance. And I would like to give special thanks to Erin, Melissa, and Kate also for the opportunity to be part of this project and for all the help they provided during this journey from day one. Good afternoon to everybody. It is a pleasure for us every time we have a chance to talk about a WE program. We are grateful for this opportunity and are very excited to share with you part of this journey and our experience implementing WE program in Puerto Rico. Next slide, please. This project was supported in part by a grant from the Administration for Community Living. Next slide, please. Okay, so today we will talk about the basis on which the program was formed, WE program components and unique approach, the impact in the community of the program, and some sustainability ideas that we would like to share. Next slide. WE program is part of the programs that GrownUps Puerto Rico offers, and GrownUps is a Puerto Rican company dedicated to recreation, health, education, and wellness programs for the elderly population. Roxana Feliciano and I, Heriberto Santiago, began organizing recreational activities for older adults in churches in 2005. And after 6 years, we identified that there was a need for recreational activities in long-term care facilities in Puerto Rico that, in addition to entertainment, would also address the lack of stimulation in the cognitive, physical, and social aspects of health and well-being. That's when we founded GrownUps in 2011 and began providing recreation programs for long-term care facilities. We later added health education division, providing health-related trainings and workshops to older adults, health professionals, and family caregivers, among others. Since 2017, we have integrated evidence-based practices to our educational programs, such as self-management of chronic disease and fall prevention, among others. In 2021, we opened the GrownUps Clubhouse, which is a private recreation and wellness club for older adults to enjoy a variety of activities, keeping them cognitively, socially, and physically active. Implementing Montessori philosophy for the adults, we created a space for new opportunities to learn, create, develop new social relations, and just simply enjoy life. In 2023, we launched the WE program with a grant from ACL to provide dementia-specific services to different groups that we will go more into details later in this presentation. Next slide, please. I would like to talk a little bit about our organizational culture. And for many people, aging is synonymous with illness, with being dependent and not doing the activities that we enjoy anymore. Our slogan in GrownUps is redefining aging, and this has nothing to do with the phrase that you might have heard that 60s are the new 20s. On the contrary, what we aim is to change that concept of aging because of all the stigmas and stereotypes about aging. What we seek is to focus on all the positive aspects of aging, making an old age a stage that we all want to reach and enjoy. We want to share a couple of key aspects of our cultural organizational culture because we strongly believe that these are some intangibles that make a difference in the service and in the way that participants perceive what we are trying to accomplish through the services we provide. These are some Montessori principles or the Montessori philosophy that we would like to share. This philosophy has some beautiful principles that make a difference when applied in any organization dedicated to service, but especially to the elderly population. We want to focus on three aspects of the Montessori philosophy, which are respect. And respect is more than just good manners. It means that you need to get to know each individual that you serve, get to know their likes and dislikes, their history, what they dedicated their life to, how they like to be called, and that the person is much more than age and health conditions. And by taking all those aspects into consideration, we show the individual respect. Kindness and courtesy rules. This could be translated to simply smiling and doing your greatest effort every day to make somebody smile, to have empathy, have eye-to-eye contact with the person we're serving, and think that whatever the person you're serving is going through, it could be you or someone you love. Using the golden rule principle of treating others as one would want to be treated by them. And when we talk about a prepared environment, this refers to the physical environment that should be safe with no barriers, should be clean, well illuminated, and use the appropriate use of colors. But even more important than the physical environment, we believe it's a psychological environment, which refers to a place free of stigmas and stereotypes, where we focus on the person's capabilities as opposed to their limitations. What abilities the person retains and what we can do to help the person accomplish their maximum potential. These principles will create an environment where participants will feel motivated, they will feel that sense of being part of a community again and the feeling of accomplishment and actualization. Next slide, please. In terms of our catchment area, because of our geographical location, our catchment area was the municipalities of Bayamón and Guaynabo, which are near to San Juan, our capital. And some characteristics of our population that I'm going to share with you, we took from the Puerto Rico Health Department socio-demographic profile of the elderly and the US Census. And it shows that Puerto Rico's population is 98.8 Hispanic or Latino. Also, in terms of age, by the year 2000, Puerto Rico's median age was already 32.1 years. And according to our last census, Puerto Rico's median age is 42.6 years. It is expected that by 2050, the median age will be 52.9 years. To that, we add the leading causes of death in people 60 years and older, which are heart diseases, cancer, diabetes, and Alzheimer's. This means that we have many risk factors in our communities, putting our population at a higher risk of developing dementia. Next slide, please.
These are the groups that we serve at We program. We have the Living Alone group, which we define as people at least 55 years old, living alone with suspected dementia or diagnosed dementia at an early stage. We also have informal caregivers that are people over 21 years of age, caregiving people with dementia. And when we talk about informal caregivers, we refer that family or friend that does not receive economic remuneration for the hours dedicated to care, and that in most of them doesn't have a formal education or training on it. We also have the non-living alone group, which is the group that we added on our third season, defined as people with suspected dementia or diagnosed dementia at an early stage, but does not live alone. And we have also the community, because we provide dementia basics training at faith-based organizations in the community, and these trainings are open to the community in general. Our main focus today on this presentation will be our at-risk group. This group, as Heriberto mentioned earlier, we already know that Puerto Rico, most of the people here is Hispanic, so we have a greater risk of developing Alzheimer's or related dementias. So we decided to include other factors that put us at an even higher risk. So for this group in particular, we has this inclusion criteria, which is people over 55 years of age or older, with one or more of the following risk factors, which are diabetes, cardiovascular disease, depression symptoms, family history of dementia, and risk of social isolation. Next slide, please. When we talk about our participants in this first graph, you can see the distribution of age range. We have had participants from the age range of 55 and over 90 years. We have served a total of 101 participants, 42 of them being in the greater group, which is the at-risk group. In the second graph, we can see the gender distribution with the majority of the participants being female. Specifically, in the at-risk group, we had 76% female and 24% male. As you can see, the male percentage is lower. Although the population of women is greater than that of men, the difference is not as significant as this graph shows. What we have identified is that women tend to enroll more in our workshops and participate more in social gathering events than men. Next slide, please. As part of our unique approach to risk reduction and improve brain health, we implement in our program a variety of activities, this right here. But before discussing each of them, we want to present a short video about our program so you could have a better idea and picture of what we do here in we program. Next slide, please.
Ha sido una gran bendición y un buen foro para uno no solamente repasar unos conceptos, sino aprender también nuevos conceptos de las etapas en las cuales estamos entrando como personas adultas mayores. Pero también nos dio la oportunidad, por ejemplo, en el caso mío en particular, de interactuar con otras personas aún mayores.
Me paso en mi casa practicando todo lo que aprendí aquí. Ha sido de mucho crecimiento porque normalmente uno está solito y entonces esas matas te llenan, te dan vida, tienes cositas para comer, para consumir.
Y este taller a mí de verdad que me cambió la vida. Le hice comida hasta a mi esposa. Y yo no me atreví a hacer un huevo frito y ahora hago arroz guisado con pollo, habichuela, o sea, de todo. Y las batidas que aprendí a hacer aquí, la batida de fresa con papaya, con leche de almendra, un poquito de vainilla, eso quedó gourmet. Me la gané.
Thank you. So as shown on the video, we include a variety of activities in our risk reduction program. One of them being the educational workshops covering topics like Dementia 101, where we discuss the basis of dementia. We also include the topics like diabetes management, depression and fall and accident prevention, among others. Next slide, please. We have a fall and accident risk reduction exercise program where each of our participants complete a series of physical exercise for strength and equilibrium with one of our partners, and Heriberto is going to explain a little bit more about that partner specifically. Next slide, please. We also offer cognitive stimulating activities to preserve cognitive functions of our participants with one of our partners. Next slide, please. We have some meaningful and social engaging activities because we notice that socializing is one of the best things that we added in our program for them and for the better results. So we have cooking workshops using the Mediterranean diet recipes for healthy eating, and also we include Puerto Rican recipes. We have also aromatherapy, horticulture, relaxation exercise, crochet, Japanese binding, and others. Next slide, please. As part of our program, we offer psychoeducational sessions to all of our participants. We have a psychologist, and all of our participants have the experience to have at least one session either for psychoeducational topics or for counseling sessions specifically. Next slide, please.
Okay, talking about our partners and relations, we have Strong Physical Therapy and Performance is a group of doctors in physical therapy and physical trainer that they evaluated each participant and implemented a varied exercise program to reduce fall and accident risk and or improve physical strength. Next slide. I'm sorry. You can go back, Cameron. Sorry. Neuroactivo Memory Care Center is a cognitive rehabilitation and stimulating center dedicated to educate, guide, and preserve cognitive function of its participants through cognitive stimulation activities. And the Center for Psychological Services and Active Aging, Dr. Yahaira Reyes is the main psychologist at the center, and she's a clinical psychologist that has dedicated to provide psychological services and psychoeducational interventions for older adults and also their caregivers, family caregivers. Since our beginnings, we have maintained a strong relationship with faith-based organizations, pastors, and other religious leaders. And these organizations are constantly serving different needs in their respective communities. Therefore, they are an excellent reference to get to know what are the real community needs. Also, their members are usually an excellent sample of their surrounding communities. So that's something you can also take advantage of and use if you want to create focus groups. Next slide, please.
So we wanted to share some impact of our program, and as part of our Dementia 101 educational workshop, the participants complete a pre and post test, and all results in general says that there is an increased dementia knowledge, including dementia risk. So the general change in knowledge is of a 51%. Specifically in the at-risk group, this change in knowledge was of a 52%. We also use the PHQ-4 tool for detecting both depression and anxiety disorders, and our program had an impact in mental health, incrementing the normal levels and with less severe levels. Next slide, please. The fall prevention exercise program is focused on the reduction of fall and accident risk, as we mentioned earlier. Therefore, the trainers evaluate each of the participants at the beginning and at the end of our program. So here we have the results of the length, strength, and endurance test. We can see the average score for women and men according to their age range. Our participants, even if some of them are not in the average score, each group of them improved their leg strength, meaning a reduction on the fall and accident risk. Next slide, please.
Now I would like to talk about marketing and recruitment. In our case, we focus on our marketing and social media to maximize our resources. And I would like to share, keeping in mind what we mentioned in the beginning about our culture and our slogan, redefining aging, I'd like to explain how you can promote physical activity and meaningful and social engaging activities differently. We already know that there's many older adults living sedentary lifestyles, not doing physical activity and socially isolated. And we've all seen that classic picture of the elderly sitting on a chair, alone, sad, just looking through the window. So that is an example of how you can focus on negative aspects of aging, and that helps perpetuate the mentality of aging as something negative. Now, on the other hand, you can see that showing pictures of older adults doing physical activity, smiling, and enjoying life in general will send a message that there's other alternatives to a sedentary lifestyle, and that there are older adults that do enjoy life, that do exercise, socialize, and do many other things that they like. Next slide, please. This unique approach drew the attention of local newspapers and local TV news because it's something refreshing and that gave us additional visibility through mass media resources that we would not have been able to afford even if we want to. Next slide, please. During Christmas, we program, among other organizations, was invited to participate in the creation of ornaments for one of the Christmas trees on the governor's house in Puerto Rico. So every year they choose a theme to decorate one of the trees, and past year it was dementia awareness. So these are all opportunities that you can take advantage to boost your program's marketing strategies. Next slide, please. In terms of sustainability ideas, there's Title 3D funding for evidence-based practices. And in our case, is something that we are working because it could fund or help sustain caregivers programs, fall prevention programs, and other programs that are evidence-based. You can use those funds to sustain part of your program. Here in Puerto Rico, there's many veterans, and the VA administration doesn't have enough. They're always looking for resources outside in the community because they don't have. There's too much, a lot of veterans that they can't serve. So they are constantly looking for resources outside of the hospital, and we are currently in conversations because they are interested in us providing service to caregivers and other veterans that are participating in similar programs to reduce risk of dementia. In terms of the diversification in the search for alternatives of sustainability, we have a garden with the horticulture program, and we could do a vegetable market. You can do a vegetable market, and this will probably not cover the whole cost of the complete program, but at least you can get funds from those sales to cover the cost of materials, additional seeds, and the materials that are used for that specific part of the program, which is the garden. We also have a kiosk where we have crochet necklaces and notebooks that we create on Japanese binding that we are selling on our kiosk, and that those sales would also cover part of the cost related to materials that we use on arts and craft and the crochet program. Next slide, please. You can see here on the slide some pictures of our kiosk. These are the notebooks with the Japanese binding notebooks, and some crochet necklaces that participants created that we are selling on our kiosk to cover the materials for that crochet and the craft that we do on the program. Next slide, please.
We wanted to share some testimonials of our participants so you can have a better idea of the impact that this program has made on them. So the first one says, emotionally, I am more alert, more willing and eager to experience many more things. The second one says, yes, I have learned that exercise is very important for my life, that I have to stay active. I already joined a gym and I'm going 3 times a week. Now I will start going more when the program ends. But yes, the physical part has been 100%. And the last one says, well, in the aspect of sharing with other people, I like it. One becomes friend and already has future plans to meet and do other activities together. So this shows us how this program has impacted them emotionally, physically, and socially, that they are already planning to gather again and have some other activities, stay active and emotionally feeling better and receiving all that they learn here to practice at their home later at the end of the program. Next slide, please.
Well, finally, I would like to share some of our contact information. And that QR code, it will take you to the Facebook page of the WE program, and you can follow us and keep up to date with the things that we are working every week. We are still running the program, so it's an invitation that you can join us and keep in touch with us, and we'll see you later. Thanks for the opportunity.
Thank you so much for your wonderful presentations. We appreciate it. We're going to collect questions now through the question and answer part of the webinar platform. You can go to that next slide, Cameron, that's fine. And while the questions are populating, I just wanted to let everyone know that the program that Heriberto and Ya'Aliz spoke about is funded by the Alzheimer's Disease Programs Initiative through the Administration for Community Living. There is an open funding opportunity right now, and applications are due June 11th. You can find the opportunity at grants.gov. You can search the word Alzheimer's or just ADPI, and you should be able to find it. Also, if you have questions about the webinars, you can reach our group at NADRC-webinars@rti.org. I am going to start getting to the questions now. If we could take a minute on this slide, Cameron, and then go back to the prior slide with the contact information for our speakers, that would be helpful. The first question that we have is for Heriberto and Ya'Aliz. Can you talk a little bit about how you conducted outreach when your program first started and how you're continuing to do that now that the program is up and running? Heriberto, do you want to start?
Yes, sure. Well, as we mentioned, from our beginnings, we have a strong relationship with faith-based organizations and our surrounding communities. So that was like the first organizations that we contact, because pastors and other religious leaders on those organizations, they are constantly serving their communities, and they already know who is in need. They identify for us and refer cases of persons that had already a diagnosis of dementia, any type of dementia, but also persons that they were suspected that they were having some cognitive issues, so they refer them to us. And the other part was through social media. That was another source that we use to not just to market, but also to recruit. There's a lot of elderly older adults using social media, but also their sons and their kids, and usually they are the ones, the family caregivers, that were contacting us, and they visited us interested for our services for their parents.
Great, thank you so much. And did you have those relationships with the faith community prior to starting the program, or did you have to build up those relationships as well?
We already had relationships from prior to the program, because GrownUps started before being GrownUps. Roxana and I were working as volunteers developing elderly programs, recreation programs on churches. But during the program, we also reached out other organizations that we didn't have a relationship with, but because of the relations that we previously have, it was easier for us to be referred by other pastors and other religious leaders as well.
Got it. Big question for lots of people all over the world probably is, how do the participants get to your program? Do you offer transportation, or are they brought by a family member? How has that worked out?
during the process of the majority of them, they come here with either a caregiver. There's also some sorts of public transportation that they brought them here. But also we in the process we bought a van to provide transportation in the process. But the majority of them, they have a family caregiver that brings them here, or even at the risk program they come they self-driving.
Okay, great. Can you talk a little bit about the staff who run the program and the training they receive?
We have a different persons. We have Jalis, which is our case manager. She's a clinical social worker. We also have what we call facilitators. They were trained on dementia basics training, and Roxana and I are master trainers for a couple of evidence-based programs, and we train them also as leaders for those evidence-based programs for caregivers specifically. And all the partners that we have, the physical trainers and Neuroactivo and the psychologists, we also provide them with trainings on dementia basics, also effective communication with persons with dementia, and all the other trainings that we have. We had trainings for all the recipes that we provide on the cooking workshops. We had trainings on horticulture, and basically all the different aspects of our program. We also have trainings on crochet. We only had two or three persons that were familiarized with crochet, so we gave a training with a teacher that gives that crochet techniques, and now we have quite a few that know and are instructors to the participants on how to do the crochet techniques.
Great, thank you so much. All right. Can you talk a little bit about how you approach the participants and get them engaged in these activities? We had one person write in a question that says she oftentimes offers activities like what you're talking about, but people aren't really latching on to them. So can you talk a little bit about how you might get your participants excited about playing bingo or gardening or things like that?
Yeah, so basically, I think that the best thing that we have for this is specifically is the Montessori philosophy. So with the Montessori philosophy, we prepare the environment, either the physical or the psychological environment. And when each of the participants came here, they always tell us that this place is refreshing. This place makes them feel good. All of our co-workers here help us to create this atmosphere that when they came here, or either we talk on the phone with them or they come here personally, they always said that this is a place where they feel good, they feel accepted. There's free of stigma, as Heriberto explained earlier. So this has helped us a lot, because here in Puerto Rico, other programs or other activities, they always tell us that they feel like they don't give them the attention, or there isn't something prepared or something. They just go to the center and, hey, you can do this here. No, here not. We have a specific program. We have an itinerary for all the activities, so they feel that they are here and we are prepared for them. We even, when we receive them, as you can see in the video, as you saw in the video, when they came here, we celebrate them. We receive them with a smile. We know their name. We have our name tags, and they have their name tags also. So there's a relationship that we build with each of our participants. I don't know if Heriberto wants to comment something more.
Yes, and that's why we share some aspects of our organizational culture, because this population has been there's a lot of stigmas and stereotypes about aging. So whenever they participate in programs, they always think it's like in clinical environment, and there's a resistance also because of all the stereotypes and stigmas. So when we present a place where they can feel accepted the way they are, when we focus especially on all the things that they can do, we take into consideration obviously the limitations, but we have them like in the back of our minds, what our focus is what they can do, and we try to push them to or do our best so they can accomplish their maximum potential. So that motivates them to participate in other activities. Also, we just came from when we started, we were coming out from the lockdowns, from the pandemic. So they were other adults are usually they're not as socially engaged as other groups, but in the pandemic it got worse, and especially because they knew they were a sector of the population that was at a greater risk. So opening our doors after the pandemic and being able to socialize with other their peers and with other persons like us, and like the environment of our personnel, it's key, because it's what's gonna give like gas and light up the environment when in that first interaction with us, and that will make them feel motivated to continue to come to the program. Our program is 10 weeks long, and they visit us. Some groups are visit us 3 times a week, and the consistency of a system of, especially on the at-risk group, was almost perfect, because and whenever they couldn't come, they call and they feel bad because they were gonna miss with the meeting with their friends. So it's been a great experience, I believe. And going back to the question, that your environment that you create and just make them feel comfortable in the space will make a difference. And we need to believe that and try to take all stigmas and stereotypes from our mind, so they can feel open and feel good about interacting with you and their peers in the program.
Great, thank you. You mentioned possibly working with the VA. Can you talk a little bit how that might work? Would they be a referral source? Would they, be another location to offer services? How would that work as a partner?
Well, fortunately for us, we are in a very strategic location. So we are near the San Juan VA hospital, and also there's a train station that goes to the VA and also is near us. And it actually was one of our participants that is a veteran, and he participated on the program, and he went back to the VA to another program that he's participating there, and he talked to his doctor, and he mentioned us, and so she contacted us, and we're still on conversations to see, because they do have many different programs for caregivers, to mental health programs and recreation programs. But like I mentioned before, at least in Puerto Rico, is one of the jurisdictions where there's a lot of veterans, too many veterans, and the VA doesn't have enough resources to assist them. So they are constantly looking for other services and organizations in the community that could assist them. And so we are right now on those conversations, but we still don't know how if it's gonna be, because they also mentioned they even provide transportation if it's something near. So we're still on those conversations to see how it's gonna end. but it's just a door that that's what I mentioned, but it's another organization that is a door you can knock on to see how you can get different part of your program. We usually tend to focus on one big grant that will cover the whole aspect of the program, but you can search for different funding opportunities or other organizations that could at least sponsor one part of your program, and that way you can still maintain the program with different funding opportunities.
Great, thank you. Can you talk a little bit about what happens after the 10-week program ends with your participants? Can they come to other programming? Do you have follow-on programming for them?
We have had participants that they re-enroll in the program, but we also have the GrownUps Clubhouse and other educational programs that we have for self-management of diabetes and other programs. And it was interesting, but once they got to know us by they are following us in social media, and they are constantly calling us to see what other programs we have that they can participate. So it's been a great opportunity to keep in touch with them, and they are always putting comments on Facebook. Whatever we post, you will see their comments, and they are anxious to get to know what other things we are doing, so they can participate as well.
Yeah,
Right.
so I wanted to add something more. We also have follow-up interviews. So either it is a few weeks or 3 months later, or workshops, we call them and we do a little interview to get to know how they are doing, what activities they continue to do, and also tell them about our different other activities that we have to offer them, and see if they want to enroll in another thing.
Great, thank you so much. Do you have any plans to expand to other areas of Puerto Rico?
Yes, actually, we have the feedback has been great, and especially because of the relationship that we have with religious organization. We've had many other organizations outside of the catchment area that we initially had that are interested. And so yes, the elderly population in Puerto Rico it's growing really fast, and there's a lot of needs for services. So we're gonna try to take advantage of the geographical location that we have. We are very near to main highways and other avenues. So it's really easy for all people from other municipalities to get here. And so, yes, we are planning to expand to other locations around the island.
Great, thank you.
You will.
I think that is all the time we have for questions today, but I want to thank all of our presenters for being here, and thank all of the participants for joining us today at the National Alzheimer's and Dementia Resource Center webinar series. We would love it if you join us again next month on June 25th for our webinar entitled Building Dementia Awareness in Tribal Communities Through Interactive Programming, Implementing the Virtual Dementia Tour. You should have received registration information via email for that webinar. We will also send a reminder within the next week. If you need to contact us or need to be added to the listserv, please reach out to NADRC-webinars@rti.org. I just posted that information in the chat, so you can feel free to copy it and send us an email if you have any questions. With that, we'll close out for today. Thank you again to everyone for being here, and especially to our presenters. We really appreciate the time and effort you put in today, Heriberto, Yaelis, and Erin, and we will see you all soon. Take care.